Hello, friends and families. Welcome to the EDUCA DPS Podcast. My name is Javier Ibarra, Senior Manager of Media and Public Relations for Denver Public Schools. Our guest today is Dr. Jane Linnemann, Student Safety Coordinator, Department of Social Work and Psychological Services for our district. Welcome, Dr. Jane Linnemann.
Thank you.
How are you today?
I'm doing okay. It's a beautiful day outside.
It's good to have you back in the studio. Today, Dr. Linnemann will be guiding us through a conversation about her knowledge and resources that the district has for us for a topic very serious to us, suicide prevention. My first question for Dr. Linnemann is this: why is this topic so important to our listeners?
You know, suicide prevention is really important because it continues the conversation around mental health. Everyone is vulnerable to mental health wellness and mental health illness. And risk of suicide is one of those aspects that can impact how we're feeling every day. We know that youth ages 10 to 24 are at risk for suicide based on what we observe, what we experience in our schools. So it's really important to open up that conversation, make sure our parents and our community knows what to look for, how to access support if they have concerns about someone that they love or someone that they support.
I want to get into this. Is there, around suicide rates, where does Colorado fare with the rest of the country?
Yeah, Colorado currently has, I believe it's the 9th highest rate in the country. It kind of fluctuates between the 7th and the 9th. The mountain region tends to have some of the highest rates in the country. And there's a lot of different reasons that contribute to why we see that trend. Some of it is because it's hard to ask for help. The area of suicide has a lot of stigma associated to it. Some folks are scared to open up that conversation, or they just don't know how to open up that conversation. Also really important to note that within that region, we have a lot of rural communities. And so, you know, similar to the Denver Metro, we have lots of access to resources, and within our smaller communities, mental health agencies, mental health providers, our schools have a lot of mental health supports, but in our smaller communities, it's a little bit more sparse. There's not always that easy access. And, you know, we need to name that sometimes accessing mental health services can be expensive for some families. And so there might be a barrier around some type of financial cost as well. Right,
so we have the barrier around financial, and then we have the stigma around it. And so that's what we hope to kind of break down in today's episode so that our families here in Denver feel supported and know where to go. My next question for you is around populations. Is there a specific population who are at greater risk of suicide?
Yeah, so we know it's really important to remember anyone can be at risk for suicide. That's why it's so important to keep that conversation going. And we also know that children and youth who are exposed to trauma, any type of discord in our communities that can be impacting their overall wellness can also increase their risk. We also know that youth who have areas of exceptionality or disability sometimes can be identified at being a higher risk. And we know that recent trends are showing that our children of color also are dying by suicide more frequently than they have in prior years. And again, anyone can be at risk for suicide. So it's important to know what those risk factors and those warning signs are to guide that conversation.
Around the main topic, right, for Denver Public Schools, you share that youth can be at a greater risk for suicide depending on certain risk factors.
Yeah.
Can you share with us some examples of what we might see that might cause some concern?
Yeah, so there's a number of different risk factors that can elevate your risk for depression or experiencing some type of suicidal ideation thoughts of suicide. Some of those risk factors can be isolation from family and friends, exposure to violence, some of the things that you might see, which is more of a warning sign, things we see or observe as a drop in grades, change in attendance, or just kind of withdrawing from family and friends, something that's kind of atypical, not something you would expect in terms of either how they're feeling, how they're expressing their emotions, or their behavior. So it's important to remember, having risk factors doesn't mean you're necessarily going to die by suicide. They just elevate that potential that can make you more vulnerable. But it's the warning signs, the things you can see or hear that are important for our families and our community members to kind of respond to if they see, and how to access support for someone who might be vulnerable in that particular situation.
And it's important to understand those risk factors as kind of signs for the future, right? And so if we're able to mitigate that beforehand, we're able to prevent suicide, which is the whole topic of our conversation today. It is important to know what to look for and how to ask the question. If someone is uncomfortable asking the question or needs help, who do they turn to?
Yeah, so I'm going to kind of walk through a number of those things that you shared.
Okay.
It is important to know all of the warning signs of what you might see or hear. It's also important for our families to know to take them seriously, which means give the space and time to really engage in some questions about what you're seeing so you can better understand what a child or a teen might be experiencing so we know if we need to get support. Asking that question can be hard if you've never asked that question. It's a heavy topic. It can be very challenging if you have stigma around mental health yourself. So it's important that I always tell our families, practice asking that question. You're gonna at times in your life likely gonna need to ask it, and specifically look at someone, provide some space, and say, are you thinking about dying by suicide? Are you thinking about killing yourself? Be patient. Let someone have a little response time to get back to you. Validate their feelings, because what feels insurmountable to them might seem something small to you, but to them, that's real feelings, and it feels very challenging to them. And there are times that families don't feel comfortable and won't ask the question. And so then I would kind of lean into your school. Whether it's your school nurse, your school counselor, your school social worker, your school psychologist, share concerns. They are trained to ask that question. They can do that with you, or they can do that independently without you. If school isn't a comfortable place, talk to your pediatrician or whoever your medical care provider is. They too are trained in asking that question. For some of our other families, it might be a faith healer, a preacher, or a pastor who also might have experience.
To remember,
who can lean in and help ask that question too. It doesn't mean that any of those individuals have to be skilled to provide services if there are needs, but it means they can at least open up the conversation, ask the question to help determine if we need a higher level of care.
You touched on this a little bit. Can you tell me more about how schools support students who might be at risk for suicide?
Yeah, so DPS is super innovative in this particular area of work, in my opinion, because we focus on the whole child. We truly are looking at medical and nutrition and overall physical fitness and mental health alongside academics, right? All of our schools have access to mental health providers. And again, that might be your school nurse, your school counselor, your school psychologist, or your school social worker. We work to provide training across our community for our adults, but more specifically with our students, we do some really intentional programming to help them identify what to look for, and if they're worried, how to engage with someone that might be a friend, and then how to access support.
This leads me to my next question. Does DPS have a lot of prevention in their programming, right? Can you share with us what DPS does in the area of suicide prevention specifically?
Yeah, so building upon some of those big topic items that I shared with you in terms of what we do for suicide prevention programming, to be a little bit more specific, we implement a program called Riding the Waves with our fifth graders, and that's going to teach them about emotional wellness, teach them how to kind of fill their bucket with affirmations and to use some of their strengths if they're struggling with something that they need to cope through, as well as helping them to identify when they're having big emotions such as sadness or depression, who they can reach out to and get help from. Similarly, we have a program called Signs of Suicide that's implemented in our 6th and 9th grade. So we're teaching them how to acknowledge warning signs, how to truly be present and share that they care about someone if they have to ask that question, and then how to tell a trusted adult. And again, some of those trusted adults are your mental health folks, right? It might be a teacher in a classroom that can then get them connected with someone else who might be able to help. And then recently in the past years, we've extended our prevention programming to our upper high school, so to our 11th and 12th grade. Something that I think our families don't know is that the risk of suicide increases between 18 and 24. There's a lot of change that those individuals experience, right? Getting a job, finding somewhere to live that might not be, where they're coming from, buying a car. It can be overwhelming, and it can contribute to big emotions. So we're trying to expand that programming to our high schoolers in 11th and 12th. We use programs that include It's Real and More Than Sad. And again, they're both suicide prevention programs that are going to teach youth what to look for. And how to access support if they need it, if they're experiencing concerns, or if one of their friends or a loved one is.
Going along with something that you said earlier, which is, asking the question flat out, right? Which I don't know if you noticed in my body language, I was like, wow, okay, so we go straight for it, right?
Yeah.
We ask it. And I think it's important for our listeners to know it's as simple as that, right? Where you can ask the question, and that's how you'll know. That's how you'll get a straight answer from your children. But going along with that, and you touched on this a little earlier, do you do any suicide prevention with staff or parents?
Yeah, we do that. One of the biggest challenges to implementing suicide prevention program is stigma.
Yes.
And one of the big aspects of stigma is that there's this thought that if you talk about suicide, it's going to put that idea into someone's head.
Right.
And it's going to move them from thought to action with intent of hurting themselves. That's not true.
No.
What it does is it opens up that conversation to give that person the opportunity to say, yeah, like I'm not feeling great.
Right.
Things don't
The
feel like
awareness.
they're not going well. And so we start with kind of that message in all of our programming with our adults. Every year, our school mental health team provide training to our educators and buildings, both our educators and staff. It might be a training during a staff professional development. It might be something that's a little bit more structured, such as bringing in a gatekeeper training that's called Question, Persuade, and Refer. Within that training, we actually model asking that question. So it gives adults the opportunity to turn to another adult and just ask that question, to feel how it comes out of your mouth, to see how it's received, so that we're more comfortable if we need to do it with a child. We also extend that training, Question, Persuade, and Refer, to our parent community. And so similar to our staff training, our school mental health will provide an annual option for parents to come into the school or join virtually to learn what are the warning signs, what are the risk factors. If I'm worried about my child, how can I ask that question, or who can I reach out to for help? So that's always very exciting work. I'm a big believer you got to start with your adults before you teach your children.
Right.
So I always invite parents, please reach out to your school, ask about those opportunities, and take advantage of some of that training.
It's important for our listeners to know, right, if they don't feel comfortable, like you said before, there are a lot of adults in your child's life or the children that you look after who are trained, who are comfortable talking about this, because it starts with the awareness and then with the training, and then we can go into the actual prevention, right?
Yeah.
We talked about whole child, and that's a big thing for the district right now. It's part of the roadmap, the strategic roadmap, whole child. And for those of you listening, right, it includes everything more than just, your academics, your sports, but it's what is the whole child, and supporting all of our needs and all of the needs for the children. Dr. Linnemann, my next question to you is, are there things that parents can do at home to support a child who might be at risk of suicide?
Yeah, I would say that the first thing that parents can do is just pay attention.
Okay.
I know we all get busy. I find myself behind my cell phone or trying to do a little bit of work, or I get pulled in 100 different directions, and our parents feel that way all the time. But take a little time and just pay attention and have conversation. How was your day? Wait for that answer. It will come.
Right.
If you get it was fine,
Right.
then you might follow up with a question of, tell me one thing that was really great in your day today.
Those in-depth questions.
Yeah, just leading questions. Something that's an open-ended question. And again, wait, give some space. Remember that things that feel big to our children are big to them.
Right.
We have lived it. We are in different phases of our lives.
Sure.
We've had to cope through different things. They're learning how to cope through those things. So provide space, time, be patient, ask the question if you're worried, and just some general opportunities for interaction, whether it's dinner time at the table, maybe it's a social engagement on the weekends, maybe it's reminding your children that they have other people in their life that if they need to talk to someone, they can also reach out to them. Not every child wants to talk to their mom or their dad or their grandma about how they're feeling in this moment, but they might talk to an aunt. They might talk to a family friend.
Okay.
They might talk to an older sibling, right? So remembering that we're all part of a bigger community, and reminding our children and our youth, you can access any of them. There's no one pathway.
Right.
But more importantly, find a pathway. Talk to someone if you need to talk about how you're feeling and what's going on in your day-to-day. A couple of other things that I think sometimes we talk about more often: supervision. Make sure you know where your children are. They're online all the time. If you can, monitor what's going on online. There's tons of tools, settings through social media that you can be a little nosy. And it's not being nosy. It's making sure you're aware if your child's in a vulnerable state or if they need support. The other thing is, there are some families who have firearms in their home. Making sure that they're locked up, they're secured. There might be medications in the home, making sure they're monitored, they're locked up, they're secured. If a child's having big emotions and they're having some symptoms of depression and they're thinking about hurting themselves, it's important to be aware of what they might have access to that they could use to hurt themselves. So intentionally through that supervision, there's also what we call means restriction, making sure that anything that a child could use to hurt themselves is kind of locked up and kept away to the best of our ability. So making sure we're having those conversations as well.
What are other resources that are available to students, parents, and community members, right? We talked a lot about kind of what we can do, asking those questions, but what are some of those resources that everyone can access to?
Yeah, so the first resource I think all of our children have access to is going to be that school mental health team. So if parents are unfamiliar with who's providing mental health services in your schools, reach out. Have a coffee chat, go to back to school night, shake a hand and say, hey, my name is, start to build that relationship so that if you need to, it's more comfortable to reach out and ask for help. And schools will do that also through newsletters and events at school. Make a little time and space and go start to really build that relationship and that partnership. I know our schools want to as well. That's a great first step. Parents also have access to any of their medical providers as well, whether it's a physician or a doctor, it might be a clinic that you frequent. Make sure that you're letting them know that you need help if you see some type of concern and you feel like you need to reach out. We also have an organization called Second Wind Fund in Denver. They provide free counseling for children who are at risk for suicide. Really interesting about that organization is they accept parent referrals. That's unique compared to some other organizations.
I was just going to say that. Yeah.
School mental health can make that referral, or a parent can call. A parent can call on Saturday to ask for a referral if that's when it's fitting in their time and schedule. There's an online referral form that they can fill out in order to get that processed. And that organization will work with our families to make sure that there's quick access to support. It's important for everyone to know there's 988, the suicide lifeline. Anyone can text or call, get connected with some confidential provider who will help walk through what's going on and help make sure that you're able to access those services. Any child can put that in their cell phone. I tell parents all the time, put it in your cell phone just in case you need to pull that out in a moment's time, right?
It's ready to go.
Yeah, unique to Denver, we have the Colorado Crisis Services, and they have a handful of walk-in locations across our Denver community. Families can walk in. There are trained staff who will help assess what is the need in that moment. If needed, they'll get you connected with some counseling referrals. If they need to elevate that concern, do an assessment, and potentially coordinate some type of transport to an emergency room for some higher level of care, they can do that too. Really important for our parents also to know, you can pick the phone up and just consult with them. If you don't know what to do, they'll walk you through that. Our schools partner with them all the time. Families can find more information online by visiting their website, or they can call their phone number at 1-844-493-8255.
Dr. Linnemann, I want to thank you for today's episode because I think that these are the resources that parents are looking for, right? It can be hard as a caregiver, as a parent, as a family member, a concerned adult in a young child's life to say, hey, I'm starting to notice something different. And I think if you're starting to notice something different, these are the resources to go about that, right? So that we never have to talk about suicide in that form because it's about prevention. So I want to thank you for coming and joining us today.
Thank you for having me. If I could add one more thing.
Absolutely.
I want our parents to know this work is hard. Having these conversations is hard, and more importantly than anything, you're not alone. Reach out to someone else if you have questions that they can partner with you. We need to do it together in order to make sure we're saving lives. So thank you again for having me today.
Thank you for that last piece as well. All right. Denver families and friends, this concludes our EDUCA DPS podcast. I want to thank everyone for joining us, and I want to invite everyone to share this resource and share the resources that were talked about on this episode. If you don't need it, someone you know might, and so it always helps to share it. For more EDUCA content, please follow us on our YouTube channel at Denver Public Schools Plus. My name is Javier Ibarra. See you next time.